Term committee meeting on race and access opportunity to order. We are a little bit shy of a quorum, so we'll start this meeting for information only, and as it moves forward, may move to official capacity. Oh, and there is Senator Neal now, so I believe that gives us 7, and that will be enough for quorum. Okay, if I could remind everyone to silence your cell phones, and we will start looking for call the roll.
Senator Berg, Senator Neal, Senator Westerfield, Representative Brown,
Here.
Representative Heverin, here. Representative Kulkarni, Kimberly Baird, Divine Karama, James Coleman, Jameer Davis, Lyndon Pryor, Co-Chair Timoney,
Here.
Co-Chair Bledsoe.
Here. Thank you so much. I first just want to say thank you for allowing me to be your new co-chair. I was recently named to the commission, so I appreciate your understanding and grace as I move into the role. We had hoped today to have a presentation on Juneteenth, so I don't want you to think that we forgot. We had several people who wanted to be a part of that conversation and just could not make logistics work, and we didn't want to break it up into 2 or 3 different times. So we're going to put them all together when all the presenters can do it, so we give it the time and dedication we wanted to. So I don't want to slide over that's not on the agenda today, but it will be a part of one of our next meetings when we can get the presenters here. So our first presentation today is one that yes, sir.
I'd just like to make note for all the people that are watching that tomorrow is June
It is.
19th, and it's the official Juneteenth holiday, and something that we need to fix here in the Commonwealth in Kentucky. The governor made it an executive order, and we have yet to get the bill put into committee and heard in committee and subsequently make it a state law. So hopefully we won't be as long with the Juneteenth holiday as we were with the Dr. Martin Luther King Jr. holiday.
Thank you, sir.
This next session.
And we will do that together. We'll do the presentation and the bill conversation at one time.
I'll sponsor it, you co-sponsor it, or vice versa.
Sounds good.
All right, thank you.
Thank you. Our first presentation today is from the United Way of the Bluegrass, the Marksbury Family WayPoint Center. I'm actually very familiar with the WayPoint Center. They're doing a phenomenal job. Just opened up this new center in Lexington, and so we wanted to give them an opportunity to talk a little bit about what it's doing and what it's going to be doing in the future. So if you would both introduce yourselves for the record, and then you may have the floor.
Absolutely, Senator. Thank you for having us. My name is Timothy Johnson. I have the pleasure of serving as the President and Chief Executive Officer of United Way of the Bluegrass.
Good afternoon.
It's not on.
Is it on?
It's not.
There we
you
go. Good afternoon. I'm Patrice Muhammad. I am Vice President, Community Impact with United Way.
Outstanding. So thank you very much, Commissioners. On the behalf of the staff and the board of United Way of the Bluegrass, we appreciate you all inviting us here today and having the opportunity to talk about United Way of the Bluegrass's impact across the Bluegrass region. For those of you all who may not be aware of United Way, you might be the few who aren't. We're a 103-year-old 10-county regional philanthropy organization. We have a footprint that serves the 10 counties of central Kentucky, but in some of our programming, we also serve 92 of the 120 counties of the Commonwealth, which you'll hear about in a moment. And I'm very proud to say that, we were here starting in 1921, really on the heels of helping the community heal and recover from the Spanish flu pandemic, and was very proud that we were here also during the current day pandemic that we are now, on our way out of in terms of COVID-19. So your United Way is here really fighting for the education, income, and health of folks in our community. We've been on a transformational evolution over the last few years. From being, many people United Way from its days of simply being the workplace campaign organization where employees, individuals can give some money out of their paychecks to help other nonprofit organizations, really a community fundraiser. We've evolved over the last century really into being a community impact organization itself. And we believe that the Healthy Your United Way should really act as a barometer to the healthier community. So the healthier and the more vibrant and leading your United Way is, that says a lot about our region and our community. Part of that journey has included reaffirming United Way of the Bluegrass's commitment to diversity, equity, inclusion, and belonging, and the work that my colleague is going to talk about in a few moments. Today, what we're talking about is really helping families and helping individuals get on a pathway that's going to lead to a thriving life and not simply just surviving or making ends meet. She'll tell you about what United Way does in 2024, and I think it's even more important what we do to understand why we do it. The work at United Way of the Bluegrass really comes from a deeply held belief that every single person in our community deserves the right to a thriving life. They all deserve to have a safe community, access to good health, a good job, education, quality education. We want everyone to feel like they have the tools in order to live their best version of themselves. What drives us really is this belief that we have. And not only that, our work also helps increase the resiliencies of our communities. Oftentimes low and moderate income communities, but oftentimes these low and moderate income communities are also communities of color. So we want to make sure that everyone has access to the tools that they need and that everyone has access to their United Way. And I'm excited today to have my vice president here talk about the work that we're doing in leading the way since 1921. You see the slide on the screen now.
Thank you. Thank you. Talking about the work that we do here in the community, I'll start with, I guess I'll back up just a little bit. To talk about the WayPoint centers you all invited us here to talk about. That's been an evolution of our impact work. That if we think about 20 years ago, the United Way started doing direct impact work through the VITA program, the Volunteer Income Tax Assistance, where thousands of Kentuckians are able to file their income taxes for free. So it's a great opportunity to engage volunteers in the community to actually perform the taxes, but then also provide that service to the low to moderate income individuals in our community. So more than 4,000, almost 5,000 individuals each year get their taxes done through the VITA program, and we're able to return millions of dollars to the Bluegrass through the earned income tax credits and things that they're able to get by getting their taxes done for free. Then also 20 years ago, we started our 211 program here in the state of Kentucky. And 211 is a health and human services resource that people are able to call for. You know, when people call 211, usually they're calling with maybe one or two problems. And then our staff, they are trained to intake them and speak to them and find ways to solve all of the problems that they may have social service wise. So again, we're making connections to people, to other nonprofits, and we're making human service connections to things like Medicaid referral. So our team, they've taken over 25,000 calls this year. We also have text message services. Also, we get a total of 32,000 requests for 211. Our staff, they work remotely throughout the state of Kentucky. They're taking calls in 92 of Kentucky's 120 counties. 211 has been a tremendous resource, and we appreciate the support that we've been able to receive from the state to allow us to expand throughout those 92 counties, but also to provide other services that we've been able to do. Many people have been talking about the social determinants and social drivers of health, and that is a new legislative mandate from Medicaid and Medicare. There is an assessment that is done when people sign up for Medicaid, and our staff has been trained to be able to take those assessments and process those. So when we talk about the evolution of our work, we start talking about WayPoint. And the initiative started because we felt that zip codes should not be a barrier to your success. In Lexington, as an example, we've got a zip code 40513. So that's the Dunbar High School area, Palomar area. The median household income when we started WayPoint in 2021 was $105,000, more than $105,000. But in 40508, off the Georgetown Street corridor, the median household income was just $25,000. So what can we do about that? That's where WayPoint comes in, that we started to think about these huge income disparities based on where people live. So amid the pandemic, when we got started, we were a true hub and a one-stop shop in the WayPoint centers. And there, we were able to meet people where they were, and people were showing up with similar challenges. People needed access to job seeker services such as resume assistance. They needed help finding employment, rent and utility assistance. They needed enrollment in state-sponsored medical insurance like Medicaid. So what we did was we were able to bring all these providers into the WayPoint centers in our 4 locations. In Lexington, we have 3. We have one in the East End, in the Black and Williams Community Center. One in the West End, in the Black and Williams Community Center. One in the Cardinal Valley area. We call that our Centro de San Juan Diego WayPoint Center. It's inside of that community center. And then we were previously in the Charles Young Center in the East End, and we'll speak more about the new WayPoint Center that we have, the Marksbury Family WayPoint Center in the historic Palmer Pharmacy. So in each of those centers, we were able to bring together all the social service professionals to help people overcome the barriers that they were experiencing throughout the pandemic, and we're still doing that today. What we learned throughout the pandemic is that those problems that people had, they were exacerbated during that time, but these are the problems that they still have, and we need to help people reach a point of economic stability and then mobility. So we have 3 outcomes when people come to the WayPoint Center. The first one would be stability. 1, we want to make sure that their basic needs are met. Good physical and mental health, that their family is able to really meet any future needs based on a budget. Then we move them into the growth phase, where we start thinking about things beyond day to day, right? And start thinking about how they can build up their credit, how they can responsibly use credit and debt, right? Then we move into the empowerment phase, and we hope that everyone is able to reach this so that they are thriving beyond their zip code, just like their neighbors across town, that they start to own at least one asset, maybe build a big savings account, purchase a home, a car, whatever it is that they determine is their needs. I'm going to play a short video about the WayPoint centers so y'all can get a little bit of visual of what it looks like inside of one.
Here's how soldiers eliminate mosquitoes around them in just 90 seconds or less. This simple but brilliant trick is...
Love the commercial.
As I look at those that have walked through the door of WayPoint, several stand out and all are on my heart. My passion is to make the community healthy all the way across the board. So a young lady had come in to see me and she kind of said, "Are you Miss Jerry?" And I said, "I am." And she was like, "I need some help. And I heard you help people." And so that's how it started. And she sat down and she said, "I don't have a crib for my baby." And she was definitely pregnant, and she told me she was 7 months. And so I said, "Okay, let me help you with that." And so we were able to address that. And in doing so, we found out that not only did she need a crib, but she needed a place to live. She was staying with different friends, sleeping on the couch, sometimes on the floor. So we built from there. So what started as "I need a crib" went to needing prenatal vitamins, not realizing that her insurance covered them, and us making that call and taking care of that, needing transportation because she had a high-risk pregnancy and was missing a lot of appointments because she didn't have transportation. For us being able to call her insurance and address that, now she has transportation, to completing many applications for housing, and just so glad to report that within 2 weeks she now has an apartment, to needing furniture, which now that's taken care of. So when we look all the way across the board, needing some parenting skills, she shared with me, she said, "I want to be a good mom, but I don't know how." And so I let her know just wanting to be a good mom is where it starts, and we can direct and help along the way. So I was able to, with a partnering agency, call them and get her set up, and they will help her through the rest of her pregnancy, and then after the baby's born, on teaching her what is normal development, what to look out for, how to interact, how to bond with your baby. She just recently, yesterday, called and said she's decided to nurse her baby. I said, oh, wonderful, let me connect you to someone that'll help with that at the health department. And so just from her coming in and wanting to be such a good mom, being young, and saying, I need a crib, because in her mind, that was the immediate need, which I affirmed that. I love that she wanted to invest in her baby, to being able to go from needing a crib to now having housing and furniture, and she wants her GED. She's already connected with the agency to do that, which she was able to do all of this at WayPoint. She didn't have to leave when she came to meet with me, to wanting a job, which now it's temporary, and they'll move her into permanent once she has the baby. And even she said, I can't believe this happened. She said, I had been calling different places, trying to get help, getting answer machines, trying to set up appointments. And I said, that just shows the terrific mom that you're going to be, because you didn't give up. And so now she's on a much better road. And the one thing that she said, I'm hopeful. And that touched my heart. And that makes me, that affirms to me what WayPoint is and what we can do for the community. Just come and let us help. Let us try. We'll work it out together. I always say you're not alone. We will work this out, because we are a community and we have to be united.
Don't risk losing the photos and videos from your phone. This innovative device
There we are. So let's talk a little bit about the path. When people come into WayPoint, again, our mission is to empower people to make their own decisions, their own choices, and have a hand in their own financial mobility. So we take the time to do a one-on-one assessment when people come in. And our staff, they take the time to find out their individual needs. They may be at that stability phase where what's keeping them from making ends meet is that they need a better job. So they will talk to them about their goals as far as education, maybe some short-term training programs that we have access to, a CDL program or a CNA program. Then we also take a hands-on approach to speaking with them about their budget. What does that look like? And again, making sure that they're able to make ends meet. But then we take a holistic approach because it's about the whole person. So in the intake, we ask them about their health. When's the last time you went to a doctor? Do you have any barriers like transportation to getting there? So we talk to them about all the opportunities we have, such as supplying bus passes or connecting them to opportunities for rideshare services. And then our best client is one that has a source of income, right? So as we're talking about WayPoint and transitioning from the work we did during the pandemic, so many people were unemployed, but once they gained employment, what were they going to do with that first paycheck? When we talk about preparing taxes for people, when they get this huge refund, what are you going to do with that refund? So those are those conversations that our staff has, because they have now been trained and they've received certificates to make them all actual financial coaches. So they're able to provide that one-on-one assistance to really make sure that people move beyond the need for safety net services into that empowerment phase. But if people do need some of those safety net services, we can still make those referrals. So that's why we still consider ourselves a one-stop shop. So we'll talk about this new WayPoint Center. So our new WayPoint Center is at the historic Palmer Pharmacy. Many people are familiar with the Palmer Pharmacy that was at the corner of
5th and Chestnut.
5th and Chestnut. I was about to say Elm Tree Lane, but I was taking us back to the Lyric Theater. So 5th and Chestnut Street. Thank you, Timothy. So our Marksbury Family WayPoint Center in the historic Palmer Pharmacy is really an investment to give back to the East End, to bring life back to that corner. As you can see, there is a lot of work that had to be done, and we were so glad to be able to celebrate with the community on May 13th as we opened that center. So again, the historic Palmer Pharmacy, it was occupied by one of Lexington's first Black pharmacists. There were healthcare services provided there, along with the drugstore and an ice cream counter. United Way of the Bluegrass, we're part of the revitalization of that neighborhood. And by utilizing services of the WayPoint Center, the residents in that community won't be left behind. With the proper tools, they can thrive just like their neighbors across town. So what are our expected outcomes? We expect that clients will have an overall understanding of their finances, that they will feel empowered and equipped to make decisions based on their own goals and aspirations. And as shared in the video, we've helped clients find safe and affordable housing, complete FAFSA forms, apply for financial aid, apply to short-term training programs. We've helped clients apply for multiple years of tax returns, and then they return to talk about the best use of those funds. Since WayPoint Centers have opened in 2021, we've helped more than 4,000 individuals, and those also represent families. We've made over 33,000 service referrals to other local nonprofits. We help people with housing needs, healthcare insurance, job seeker services. So with that, we are available if there are any questions, but we also wanted to make sure that we say that we're looking forward to a lot of the new information that will come out through the social drivers of health surveys and the information that's being gathered by healthcare providers as they screen patients for their health-related social needs. And there is an increased desire that research has shown that healthcare providers really want to be able to help their clients and make sure that they're able to refer them to these partners where they need help. And that's where the United Way and 211 has really stepped up with our WayPoint initiative, as well as 211, that we've really been able to help people connect with any needs that they may have.
Thank you both so much. For the non-Lexington people, the Palmer Pharmacy was a long staple in the community and fallen into some disrepair and became kind of a public safety hazard, to be honest, in the area. And there was a great deal of effort to restore it, to keep it, honor it, but it did not come at a cheap cost. And so the city put a lot of money in to help do that, and the Marksbury family provided a lot of private investment to do something really transformative in that space. And like you said, where you are matters, and being right there in the corner to help people walk right in and get all their needs met, but quite a bit of them, was really integral to the success. So I really applaud the hard work it took to get there. I know I wasn't the only one who said, I don't know if they'll get there or not, so well done. And I'm happy to see if there's any questions or comments from the commission. None? Coach Timmy?
Thank you, Madam Chair. Thank you all for the presentation today. I contribute to the United Way through my Fayette County Public School paychecks every 2 weeks. So very, very pleased with the work that you all do in Lexington. I'm really big on supporting, giving a hand up. And I'm interested to see if you track the data on, the number that's up on the screen right there, the 4226 individuals served. How many are, how many return? How many don't return because, their sails have been set and they're sailing off into their own, to their own horizons. If you could speak to any of the data about success stories, I'd like to hear that. Thank you.
Thank you so much for that. That, there is a difference between outputs and outcomes, right? So these are outputs, that these are the actual numbers of individuals served. But we do have many client success stories, and we have been tracking that data even more carefully as we've emerged into the new facet of not career coaching, but financial mobility coaching. But we do have some data that we will be able to share with you.
Senator Neal.
Thank you, Madam Chair. I have several questions, if that's okay. First of all, thank you very much for the presentation. I know the great work that the United Way does, and know probably more about what they do in the Louisville area, but certainly I'm aware of what's going on generally in Lexington as well, so commend you on that. Madam Chair, I guess this is more directed to us, the commission, as opposed to them. They know what they do. They're doing it. They do a great job, have been doing it for a while. But I'm looking at our purpose statement here. It says the purpose of the commission shall be to conduct studies and research on issues where disparities may exist across the sectors of educational equity, child welfare, health, economic opportunity, juvenile justice, criminal justice, and any other sector. It would seem to me that, and particularly when I look at this presentation today, that they have a wealth of information because they have great involvement in their communities, just like they have in Louisville and United Ways across the Commonwealth, that one of the things that we could do is to ask them and others that come before us to provide us with their fundamental data that drives the policies that underline the initiatives that they take to make things better, because part of our effort is to identify areas of improvement in providing services and opportunities for minority communities. So perhaps that's where we are headed, but it seems to me that at each individual that brings this forward, perhaps they would be, would be willing to share that data prior to the time that they present, which enriches our coffers in terms of information and doing the fundamental work we need to make. The other observation I would make going forward is that I noticed that in our purpose statement we don't have recommend policy, and it seems to me maybe that's assumed, and of course we're policymakers for the most part, or at least part of us, and we can do that, but I'm hoping that what we're going to do going forward is to recommend action items to address those disparities that we are conducting studies and research on issues to improve. Otherwise, I'm not sure we can get into a position. Last observation is that the last time, two things, if I may. One is attendance here is going to be very important to get this work done, and people are very, very busy. It's hard to do that. I'm wondering, I don't know how we go about this, but I'm wondering if we can poll the members, if we have not, and we probably have, but we might want to continually poll the members to ascertain availability, because if folks cannot make it to the meeting, then that's not going to be beneficial to our objectives. And it may not be their lack of wanting to do that. It's because we're dealing with very, very busy people. So I think we should pay great attention to that particular piece as well. Thank you for your indulgence.
Thank you, Senator, and I agree with you on all 3 points. One, they did provide this folder. You may not have gotten one when you came in, but it has quite a bit of information that I think, to your point, provides data and research, which is what I would like us to see presented. And part of why I asked them to come is that I think they track their data pretty well and do some good policy work.
Well, I'm not addressing them directly.
Oh, I know.
I'm talking about as a matter of policy going forward. This is not whether we're doing it with this person or that person. I'm saying as a matter of policy. There may be already. I just don't know. It's our first meeting.
I'd like to do that.
Okay.
A, and then B, for follow-up, I think providing policy recommendations is absolutely critical. Otherwise, we're talking in a vacuum in here, and we're not providing some direction to the rest of the members of the General Assembly as to what we can do to make some change. So I'm very open to that conversation, and would like us to focus on the issues where I think we can make policy differences and recommendations. And lastly, I don't know about the attendance. I was told to be here at 1 o'clock, so I am. But to your point, if we're open to doing that poll with since we have some new members, I'd be certainly open to that. I don't know what the LRC policy is on that, if we have to have it, but he's going to check.
Okay.
Because I think that's a good point. Yeah. Yes, ma'am.
Can I respond as former chair of this? I greatly appreciate Senator Neal's comments. He has been a dear friend in having a lot of conversations about this. Attendance has always been an issue for our members since this commission started. And so I think it would be upon us members too, not only to figure out when people can come, but also to encourage people on the committee to actually attend if they've been appointed. If they no longer can fulfill that, I would love for them to give up their position and put someone on the committee that actually could fulfill it. We do have a lot of people from outside that have been appointed, and I think it's as pertinent for them to attend as it is us as legislators. So maybe that's a conversation we could have, Senator Neal, with members that we know have been appointed but never have attended a meeting or only have attended one. How do we get them here and engaged? Because it really is. It's both sides and all types of backgrounds that are really going to change the disparities that we have among Kentuckians.
Further, this is a new beginning, so it's an opportunity is the way I'm looking at it. And we did have the experience of the last iteration of this effort, and that was a very serious problem. So I think that really fundamentally has to be addressed.
The attendance piece.
Yeah, absolutely.
Happy to do it. And I will say on behalf of Senator Whitney Westerfield, he had planned to be here, and his wife, they had to go to a doctor's appointment.
Yeah,
that
that's
happened a
acceptable.
little bit quickly. But he did want to be here today. But I think you're right. If we don't have people in the room, it's real hard to move policy in the conversation.
Yeah, and keep in mind, this is not aimed at anyone. It's very, very busy people. It's just like I came up here and I got behind a line of cars that I did not anticipate. It held me up for about 20, 25. Things happen. I understand that. But I'm just thinking that if we are more intentional and really aggressive about that, it would be helpful.
Yes, sir.
Yeah.
Happy to do it. Thank you for indulging our conversation and providing us with good data and research. And I think what the WayPoint Center does is fantastic and addresses the economic issue that we've talked about. How do we get people who aren't in the right zip code to maybe have a better outcome? And I look forward to Senator Neal's point. As we've talked about earlier, as you move during this discussion and the center becomes busier, if you will, bring back recommendations to us on what you think might be helpful that we can discuss as a commission to move that drive faster.
We'd be happy to, and we'd want you all to use United Way as a resource. So to the extent that we can provide you with data or, sort of our observations in our field, we'd be happy to do so, as well as those recommendations. So thank you all.
Thank you very much for your time and work. Next, we're going to bring up our Louisville counterparts, which are also doing some great job in Louisville, the Goodwill Industries. The West Louisville Opportunity Center is a similar endeavor on the other side of the state. So, Ms. Luttrell and Mr. Hale, if you'll introduce yourselves, and you may have the floor.
Well, thank you, Senator. My name is Amy Luttrell, and I am the president and CEO for Goodwill Industries of Kentucky. And this is Adam Haley, who is our director of policy and strategy. And we appreciate you all having us here today to speak about our new West Louisville Opportunity Campus. We would like to give you a little bit of context, just to take a few minutes before we do that, and talk a little more about what Goodwill does and what an opportunity center is, because everybody may not have the same level of understanding of us. So Goodwill also has been in Kentucky for 100 years. We celebrated our centennial last year. We cover 103 of Kentucky's 120 counties. We have about 2,300 employees. We have 67 stores that we operate, and the important thing about those stores, those are the most visible part of Goodwill to most people, but the important thing about them is how they support our mission. And they support our mission in two ways. Number one, we have about 1,900 jobs in those retail stores that are available to give people a place to start and show what they can do, and it is impossible for me to go into one of our stores without someone saying to me, no one would hire me, even in this tight job market. So that's one of the things that those stores do to support our mission. And then the second thing that they do, of course, is provide some funding. And that is so invaluable. We use every year about $11 or $12 million from outside sources, mostly in the form of grants or contracts, to fund our services. But we also pair that with about $21 million, which come from the earnings of those stores. So you know that when you have a grant or a contract, you do exactly what you're being paid to do, even if there are several other things that you can see also need to be done. And so we're able to fill a lot of gaps and be very flexible and agile with those dollars that our stores produce. because they're not restricted. They haven't come to us from another source. So that's what Goodwill does. And the reason we do it all, our focus is solely on helping people escape poverty. Goodwill has for many years helped people get jobs, and we believe a job is such an important ingredient in escaping poverty. But we know that many times people who get a job don't keep their job, or they become stuck in an entry-level job and they become part of the working poor. So we know that that's a great thing, but not enough. We help people because they usually come to us with not a very good work background, or maybe they've even never worked. We help them get a job, a better job, and then a career, because we know that a career is what's going to help people earn enough money to support themselves and their families. What is an opportunity center? I put on the slide a word definition of opportunity, because I think we use words all the time and we don't necessarily stop and think about what they mean. What that word means is that conditions are right for success. And that is why we have opportunity centers, because that's an important ingredient to us in providing conditions that are right for people's success. People don't need us to fix them or take charge of their lives. We meet a lot of people who start with nothing and are highly motivated once they believe that something better is possible for them. So we're there to offer them that opportunity so that they have a fair chance for success. And that has everything to do with equity and inclusion. So our opportunity centers are facilities that are located in places that offer easy access to people, especially people who live in poverty, people who may not have a car, they may be walking, riding the bus. We need those centers to be conveniently located to them, and we need to give them a warm, friendly welcome, because many times they may not have much confidence in themselves, and they need somebody who really cares personally about their success and is ready to stand beside them for their whole journey. I was really struck with the similarities of our opportunity centers and the WayPoint centers that our friends at United Way of the Bluegrass were describing, because Goodwill believes, and it sounds like United Way has the same approach, that a holistic approach to addressing all the barriers that people face is really a key to helping people regain hope for their life. So we know that in Kentucky we have a lot of services, we have a lot of systems that are fragmented, and we know that when people don't have a computer, they don't have a car, they may not even know what services are available to them, much less be able to access them. I'm sure many of you have been through a poverty simulation. We have people on our team who do reentry simulations, a lot similar but a little bit different, specific to the problems of people coming out of prisons and jails. And so if you've ever done one of those, you know what an issue access is and what a difference that makes. We focus heavily on barrier reduction. We'll show you a matrix that we use for that in just a minute, but addressing the things that have held people back and caused them to lose hope. Skill building, if you haven't had a job or you haven't succeeded at a job, what are some skills that you need really to be attractive to an employer and to succeed in that job so you can go into a career? And then, as I mentioned, we try to provide really a community of support that's driven by that personal relationship with a career coach who is going to be involved with you long term. People who come to us are members for life. So we're not going to cut them off when the grant ends or after a certain amount of time. They have a permanent relationship with us for as long as they want it. Thank you, Adam. Our services are available to anybody. Our services are free. We tend to serve in recent years people who are in recovery from addiction, people who have come out of our prisons and jails, and people who are unhoused. And why is that? We did not say, well, this is who we want to serve. But when we opened our doors, that's who came. And we know that that's because of the ravages that the opioid epidemic has inflicted on the citizens of Kentucky, on so many families. And that's why we see so many people who are living on our streets, people who have been in prison or jail, and people who have had drug treatment, but after their drug treatment come out to kind of a scorched earth environment. They may not have anyone to assist them and support them. They don't have any money. They may not, usually don't have their ID documents. So even though they're supposed to get a job, they can't get a job until they do. So we saw that need, we saw the gaps there, and we thought that was the best way for Goodwill to add value to the communities in Kentucky, was to meet those needs. And what we have found is many, many people who have so much capability and who society doesn't often think of them as offering solutions to the problems that Kentucky has, but they can. That's what they want to do. They want to not only support themselves and their families, but they also want to be able to fill these jobs that employers need to have filled. When we think of the social determinants of health and all of the problems that Kentucky has, when you see Kentucky compared unfavorably to other states, we believe it all comes down mostly to poverty and all of the ramifications of poverty. And so we're trying to help more and more people in Kentucky escape poverty and become part of the middle class and beyond. We also hire people in our jobs who need that extra support, and we don't just hire them because we do have mostly entry-level jobs, but we tell them we want to help you move up or move out, whether you leave us for another employer and a higher level job where you can make more money, or whether you move up through our system so that you can make more money. Either one is fine with us, whatever you want to do. And most of our workforce, about 3/4 of our workforce, has the kinds of barriers that I was mentioning a minute ago. I do want to mention that we do not compete with the publicly funded workforce system that exists throughout Kentucky. We complement them, and we'll go into that a little bit more in just a minute. We don't want to replicate what they're doing and see who can get the most people in. We want to do things they can't do and have them do things that they receive funding to do. This is a map showing you where in Kentucky, it's a little bit hard to see those stars, but we do have opportunity centers. We have 12 now in 9 communities. We have 3 in Louisville that are for everybody, and then 1 in Louisville that's specifically for young adults, tailored to the special needs and techniques that are effective with them. But in addition, we do have 1 in Lexington. We have 1 in Moorhead, Pikeville. We have 1 in Corbin, Somerset, Elizabethtown, Bowling Green, and Paducah. So those are the communities where we have our opportunity centers. So this is very fine print. I think you received this, but the most important part, I think, of this is a matrix that helps us see where each person is when they come to us. So if you look at the far left column that has 10 items listed, these are the barriers that we see people having most often. These are not the only barriers that people have, but it's a pretty comprehensive list. And then the columns to the right show whether you are a level 1, 2, 3, 4, or 5. And we ask each person to tell us where you are and tell us where you want to go. But generally, if you get to a level 4 or a level 5, you're considered to be self-sufficient. For instance, if you're a level 1 in housing, you're homeless, or you're about to lose your housing. You don't have a stable place to live. If you're level 5, you're a homeowner, but not everybody wants to be a homeowner. So if you're level 4, you have safe and unsubsidized housing. And we do operate some housing in Louisville only. If we can figure out how to fund more, we'd love to take that to other communities. But that's been a successful program. About 62% of people who leave our housing are able to go into unsubsidized housing of their own. So we use this, and this is how we measure our outcomes. I do want to mention to you, and I appreciate, Senator Neal, your question about data. We're constantly trying to get better at data because it is so difficult to get the right data and tell if you're making an impact and what are we doing that's making an impact. So I want to, you can stay where you are right now, but I just want to jump ahead a little bit. So we do have several different programs that we provide. We have been able to get recidivism data from the State Department of Corrections, and we're very appreciative of that because that is so helpful to us in knowing how we're doing. We just recently got some recidivism data, and it told us that if people take advantage of any of our services at all, the recidivism compared to the statewide rate of 27% goes down to about 16%. If we get them a job, that recidivism rate goes down to 7.6%. And if they go through about 3 weeks of personal and professional development, that rate goes to 3.8%. So we're delighted with that, and we're delighted to be able to divide that by services so that we can tell, well, we shouldn't be spending this money on this. We should put it over here where it's more impactful. We're also having conversations with KY Stats that does such an excellent job for Kentucky about getting some wage data that would be de-identified because we understand Kentucky's under a lot of privacy laws. So we would not ask for it to be identified, but that wage data that can tell us how have people done 2 years, 5 years after they leave us. So we're hopeful of getting that data, and of course happy to share any of that with you all that you would like to see. Next slide. These are some of the, you don't have to understand all the ins and outs of our programs, but these I'll ask you to look at the 4 columns a little more than the headings, just to see that we have a wide range of services ourselves. We don't do everything that we access to help people meet their barriers, but these are some things that Goodwill does. So pretty varied. We do, I'm going to boil it down and say some of the things that we really want everybody to have is soft skills, financial literacy, digital literacy, and personal and professional development, because we feel like no matter which direction they decide to go, they're going to need all of those things. Then if we go to the next slide, you can see the bold face print down the left of this slide. These are the 10 barrier areas, and you can see just a few of our community partners. These are partners who are providing something that we don't do, but that is still needed, and we have them usually coming to our opportunity centers on a scheduled basis because most of our opportunity centers are smaller than the West Louisville Center and don't have room for these partners to have dedicated space, but they come on a scheduled basis. So for instance, in a couple of these, I mentioned housing, that Goodwill also has a role in that. Transportation, we have a program to help people buy cars, and we also give people bicycles if they're not ready for the financial responsibility of a car. But looking at healthcare, for instance, we don't do that, but we want to partner with others that do. We help a lot of people get on Medicaid, but then we like to say we also help them get off Medicaid when they get to the point that they don't need Medicaid anymore. So we do both at Goodwill. Next slide. So let's talk about our West Louisville Opportunity Campus. I said that we locate our opportunity centers in places where there are a lot of people who don't have very much money living around us. And so in Louisville, we have one on East Broadway, if you're familiar with Louisville geography, down on Preston Highway, and then in West Louisville. We had no presence in West Louisville, and we know that a lot of people in West Louisville don't have very much money, and we have quite a few people not in the workforce, so we thought that we should really have a physical presence there. Another thing that you might be interested in is that that location at 2820 28th and Broadway is now the headquarters for Goodwill Industries of Kentucky. We thought that by doing that, we could bring more jobs to West Louisville and make more of an impact and also just make a statement. In West Louisville, our facility is a lot bigger than our other opportunity centers, so these are the partners that have dedicated space in our center, and I'll just point out a few that have some particular significance. I mentioned that we try to complement, not compete, with the publicly funded workforce, so we have a Kentucky Career Center in our West Louisville Opportunity Center, and that moved across the street from the NIA Center, and they say they've done more than double the amount of service in that location just by moving across the street. And I believe that is because we send people to them when we know that they have a service that's available, and they send people to us when people come with a barrier that they're not equipped to meet. We also have the YMCA that we pay to have a presence there and operate drop-in childcare because we know that that's a barrier to so many people. We have legal aid there because we draw heavily on services of all 4 Kentucky legal aid organizations. And we have Norton. It's the Norton Healthcare Goodwill Opportunity Campus because they're our largest donor, but as they get their facility completed, they'll be able to come over to our campus and do health clinics and that sort of thing, and make that available to people who come in. So this is what we started with. The picture on the upper left, we demolished about 400,000 square feet of old manufacturing space that was not being used. We purchased 21 acres. It was a brownfield, and it took us a couple of years to build that. You see our groundbreaking, and then you see the building in mid-construction phase. We moved into this building for our headquarters January 31st. We needed a little bit longer to get some things finished in the building and kind of get our feet on the ground. But in April, we opened our doors. So the Opportunity Center itself has only been active for a couple of months. We already have 300 members. And so the significance of that term member, that means that people have been in multiple times and they have kind of registered with us so that they now receive a swipe card that they use to document which services they have taken advantage of. So that's part of our data collection system so that we can tell, based on the outcome that that person achieved, what services were they part of, and that's very helpful to us. Next slide. This is the finished Opportunity Center that we're very proud of. It's, I think, a bright spot along that corridor, and we're joined, of course, by Norton, that I'll talk about in just a minute, just to the south on our campus. And I know Dare to Care is getting ready to come across on the other side of 28th. And we're hopeful that this campus will provide some incentive really for some for-profit businesses to come in, because there are several of us nonprofits there. So we need some for-profit businesses coming in to also bring jobs. This facility and the land purchase and everything cost nearly $50 million. We did a New Markets tax credit deal that brought about $7.5 million. The city of Louisville put in about $5 million, and we're so grateful to mention the contribution of the state of Kentucky, and especially the contribution that Senator Neal, made in helping that to happen, that the state of Kentucky has in its current or upcoming budget $3 million. So we're very appreciative of that. In addition to that, because that doesn't add up to 50, we still have a capital campaign that's ongoing. We have some property that Goodwill owns and that is on the market, and we'll put the proceeds of that property into this facility as well. And then we just have some operating funds that are going into the facility. This is a rendering of the new Norton Hospital that's being built right now, and I believe their opening date is November 11th, and I'm sure you'll all be invited. They will have 20 hospital beds, but they say that the reason, or at least one reason, why they didn't do more hospital beds is because they want to provide more services to West Louisville so that people don't get in a position where they have to go to the hospital as often. So they will have primary care for both adults and children, an emergency department, some diagnostics, and a variety of services there. So they're going to be a great partner for us, and we look forward to their opening later this fall. So this is just a little different look to show you the types of services that people can access when they come to our campus. In addition to the partners and the services that they're bringing, we are opening a community cafe, or we're not opening it. A company called Black Coffee is adding a second location. They're on Jefferson Street in Louisville, and that will be open, I think, in September or October. We offer the community access to computers, printers, and copiers, because that was some of the feedback that we got as far as what was needed. We took about 6 months before we did final plans for this campus to ask the community what we should be doing. How could we be good neighbors? What was needed? And that was one of the things that we were told. Another thing that we were told is community meeting space. And we've been absolutely overwhelmed with the demand for people to come and meet in our campus. So evidently that was a pretty big need that we're able to meet. I just want to go back to what I said to start with, that we just have too many people in Kentucky and too many people in Louisville and too many people in West Louisville who live in poverty. And so many times it's just not necessary. We're trying to do our part, the very best that we can, to give every single person a fair opportunity to succeed and to thrive in life. We have a lot of services available to help people survive poverty, and we work closely with those organizations and fully understand the need for that. But our part, our contribution at Goodwill, is to help people get out of poverty so that they can thrive and do the things they really want to do. And I can guarantee you we have thousands of Kentuckians who are highly motivated to do that if we just all do our jobs right and make it a little bit easier and doable for them. So thank you very much.
Thank you.
Any questions for us?
Yes, ma'am. Thank you so much for your presentation. And we followed a little bit in the budget conversations about the appropriations, and Senator Rocky Adams and Speaker Osborne, I think, were very influential in those conversations as well.
Yes, absolutely.
I mean, I know that our friends over here at United Way did not receive state funding. It's not my fault. Just thought I'd mention it. Yeah, there's still time. But it's so important to have a multi-tiered funding, oftentimes where the cities and the communities step in the private sector to make some of these things work well. And what I see very similar in both of the organizations is you're putting lots of people under one roof, so it's easy to navigate. And sometimes I think when you're trying to find that pathway out of poverty, it feels like you're going 10 different places, and sometimes it just becomes too hard and you stop. So putting it all in one space really does provide that accessibility and removes some of those barriers already just by and it's a beautiful building. So I appreciate all those conversations. Commission members, do you have any questions or comments? Oh, I'm so sorry. He's got a list right here, and I wasn't listening. Senator Neal, you're up first.
Thank you, Madam Chair.
She says you have a list.
First of all, I want to confirm the extraordinary vision that was realized in terms of the West Louisville opportunity piece. Outstanding. And to witness that evolve at that critical space, and then to connect with those partners, and now Dare to Care, which is going to be a critical partner as well, is absolutely extraordinary. It didn't mention that on the other side there was an elementary school that's going to learn from all of those connective pieces, et cetera. But it's just, I'd say to this committee, and I say to the general public, it is an extraordinary development in West Louisville, or if in any other community. So kudos to you on that.
Thank you so much, Senator.
Secondly, as it relates to money, this isn't about Gerald Neal or the other people mentioned. We are public servants. We have a responsibility to address the needs. That's what this committee is about. And I want you to say that everyone is involved in that. That's what the legislative process is about. Sometimes we do good, and sometimes we do less than good, and sometimes we limit it, et cetera. But in this case, I think it's a clear shot. It's just like in the United Way when they do their work and the history that they've had in doing their work. It's clear. So, but this data piece, I just want to say this one more time, because I really don't see sufficient data here, okay? Not a criticism, and that's why I keep emphasizing this. I would ask you if you're willing to not only provide data that you all make an assessment of and come to conclusions with how to use that data, but also make recommendations, very clear recommendations on how to improve what you're doing and what others are doing in the space and related space. And that becomes very useful to what we do here. Because you're the experts in that space, not us. We don't do that work. You do that work. So we have to rely on you, the United Way, and the others that come through here. So thank you very much for that presentation, and thank you both for the work that you do. Thank you, Madam Chairman.
Thank you. Representative Kulkarni?
Madam President. Thank you. Thank you for your presentation. I want to echo the comments that Senator Neal just made around data and specifically policy recommendations based on that data. So both of the presenters that we heard from today are on the front lines of this, right? Your mission is re-entry into, right, second chance employment, second chance housing, whatever the opportunities and obligations that may arise for people who have been disadvantaged and are trying to get back on their feet for whatever reason. I had a couple of questions. I think we're missing, or I am anyway, in my packet, a couple of the slides, that matrix that you had. I don't have that, and I was very interested because my eyesight is not good enough to read what was presented. So if we could just get that one piece, it would be helpful. I did do the reentry. So we had the reentry simulation here, and there were a lot of legislators, which I was really excited to see. I'd never done one before. I mean, I did terribly. I didn't get very far. Transportation was a huge issue in the reentry simulation, and I'm assuming it's an even bigger burden in real life, because just getting tokens for the bus was one of the biggest barriers to get to appointments that you needed to get to in terms of getting housing, going to interviews. And so my question is, with regard to solutions, what have you all come up with outside of, say, public transportation or tokens or being able to subsidize some of that cost? What are some and you don't have to answer this today, but what are some really practical solutions that we can discuss or work on outside of what it currently exists, based on what you're actually seeing and where people are coming from and where they need to go? So that was one comment. I was also curious, you had on one of your slides legal services as was one of the services that you provide, which I think is really critical on a lot of different levels for folks. So what kind of legal services are you all able to provide, and are you hoping to expand some of those in the future? That you can go ahead and answer that if you know.
Sure. One of the main services that we provide with legal aid, because we don't have any lawyers working on our team, is expungement of eligible offenses. So last year we have clinics, and we're now embedding some of that into our opportunity centers so people don't have to wait for a clinic. But we pay the fees, bring in the Department of Corrections, bring in the legal aid organization, depending on which part of the state it's in, and we start with the person and follow it all the way through until that offense is expunged. So 5,300, which I believe is almost a third of all the records that were expunged in the state of Kentucky last year. That was in 2023. But in addition, our people tend to have a lot of other legal issues. Many times they have to do with housing and eviction, child support, just a variety of things that need to be cleaned up so that it's not a distraction to them. It's not something that's outstanding when they're trying to move on with their lives. So we use all of the free capacity that the legal aid organizations have, and we pay them for some additional capacity because of the extent of the need. Transportation, I wish I had a full answer to that, and we can certainly go into that a little bit more deeply later. But the transportation services that we have are, I'm going to say, four. We do help people buy a car. We put our money on deposit at a credit union. The person has to go through budgeting class. They have to have an income. So they're paying back the credit union, so they're building a credit record while they're paying for their car. We charge them some interest, but when they pay off their loan, we refund all of that interest to them, and if they default, the credit union takes our money. So this is an example of our hand up instead of a handout. The person has some skin in the game, but they get a car, and we work with auto dealers to identify cars that are in pretty good shape and fall within our price range. That works for people who are ready for the financial responsibility of a car. Many people are not. Like I said, some people come to us and have to start with nothing. We do give away free bicycles to people with helmets and all the safety equipment and some safety training. And many times that helps fill the gap until they are ready for the financial responsibility of a car. We also give out a lot of bus passes, because if people don't have any money, that's very helpful to them in getting them a little further down the line. And then at some of our stores who don't have good service through public transportation, we run vans from a central location where people can get to more easily and take them out to that location and then back at the end of their workday. So those are 4 things that we've been able to do. But reality in Kentucky is we have so many communities that don't have any public transportation. It's I have heard, I don't hear this so much since we've started the vans, numerous people going to work in our stores to make an entry-level wage, say they rode the bus for 2.5 hours to get there. And that just shows you the kind of motivation that people have. How many people are willing to do that? But we have people who've been willing to do that. We've tried to ease that burden a little bit by offering the vans. But it's hard. We've tried to look at possible ride shares, deals with Uber and Lyft. We don't have anything that has much of a scale at this point, but we just continue to explore possible solutions because it's such an issue for so many people.
Thank you. Quick follow-up if there aren't any other questions. Or either way, I'll keep it brief. I apologize. The only other 2 comments I had were around small business. I know you're trying to get folks into jobs. Is there any support or any resources that you connect with for folks that want to start their own business? And I understand that we're kind of at the we're starting kind of on the ground floor maybe with some folks, but I think this is something I know I've heard, for instance, in my own district, where people are, yes, I want to get into a job, but I really have this dream of owning my own business, and so that's a barrier. And it connects back to the legal services. How do you register a business? How do you incorporate things? What are the licenses that you might need? So those 2 points are kind of rolled into one. And again, you don't have to answer right now, but I would like to get some more information specifically around those types of programs and or plans to expand.
And I can give you a quick answer. That is not something we have done, but we have identified 5 separate organizations in the Louisville area who already do that. And so that's one of the missing pieces that we haven't plugged in yet, but we definitely want to offer that because I hear, like you do, we hear that from so many people, a desire to operate their own business. We do have the Kentucky College of Barbering there, and most people who graduate from their courses are going to operate their own business, and they do offer instruction in how to operate that business. But we anticipate bringing that ingredient into our campus, and the other one that we haven't filled yet in Louisville at the new campus is mental health provider. We don't do mental health, but it's such a need, and so that's another one we haven't filled. In the next phase of the campus, we really badly want to bring some skill training into the campus so that people can earn a credential right there.
Thank you. Chair Timoney.
Thank you, Madam Chair. Thank you for the excellent presentation. I also want to give a shout out to your compadre there, Mr. Haley. He does an outstanding job advocating for the issues with Goodwill. So thank you all. Representative Haverin had a question. How does Goodwill choose which partner organizations to work with, and does it vary by location?
It varies very much by location since we have these in 9 communities, but we're trying to address all the barrier areas that we've identified, and so that's going to be different parties in different parts of the state. We're trying to fill gaps. We have a certain amount of service available, and the remainder of the services, we want to ease access to those. So we identify partners who can help us to do that, who can fill those gaps. Also, we're looking for organizations that have a good track record, they're reputable, and for partners that have co-located with us, that's a deeper relationship. For the most part these are partners that we already had a relationship with, so we already knew each other, and that makes things easier. But we're always open to new partnerships.
Thank you. I have 2 more things I wanted to discuss. This is just kind of a comment. You know, we just mentioned ride sharing, and I didn't even have that written down on my sheet yet. One of the biggest issues impacting education today is chronic absenteeism.
Yeah.
And as a Commonwealth, I think that we would really set the tone for, being at the top of the heap when it came to making sure our people are getting to where they need to go. If we could create some type of system where we could allow for reimbursement or something along those lines with the ride sharing, because the solution is out there. There are people who drive for Uber and Lyft that are sitting there waiting for people to notify them. And then we also have organizations that could fund it, needing people to be transported, and those people are sitting at home, either not showing up at work or their children aren't being able to be brought to school because they missed the school bus. Mm-hmm. So we have the solution. It's just a matter of connecting those dots. And I think that's definitely something that's pretty valid. But my last question, Adam, could you bring up the center that's in Louisville? Who do we need to thank for choosing the color scheme of that facility in Louisville, choosing UK's colors? Is that Senator Neal? Does Senator Neal get the compliments there? Because I really appreciate that. When I saw that, it just perked up, because I was expecting that to be in, off North Broadway in Lexington, but no, it's in Louisville. So Senator Neal, I graciously thank you for the flagship University of Kentucky colors being broadcast in Louisville.
Madam Chair, if I may, I just want to encourage my colleague to adopt the spirit of which I proceed, and that is I embrace blue and red. I embrace the Commonwealth, and uplifting is what it's all about. And thank you for joining me on that.
And I didn't choose the color scheme, but I will tell you that the CEO grew up in Lexington.
Go Cats.
Thank you. And just, microtransit is something Lexington has looked at quite a bit, and trying to solve some of those issues where it just doesn't, the bus transportation system just doesn't work well. And we know if it's a time problem and a funding problem, it's the time funding that typically drives whether or not you're going to use that system or not. And it is tied to the education system.
So I will tell you that the Bingham Fellows Group in Louisville is doing a pilot right now. Their project, the group from last year, was to address this transportation issue, and it has to do with the ride shares and the Uber Lyft concept. So it remains to be seen how that will turn out, but hopefully it will go well, and we can see what's a good model that could be replicated in other Kentucky communities, because it's such a hard issue to solve.
It is. And just lastly, I wasn't aware that Goodwill spent or operated in the housing space. So will you just take a few minutes and talk about what your role as a partnership has been in housing?
We really preferred that somebody else do housing because we had never done housing before. And it's not easy to do, but our problem was that the people who came to us so often lacked stable housing. It was impossible for them to move on and be a reliable employee. And the reason why they couldn't get in, there are waiting lists, as you know, but many times they can't even get on the waiting list because they have some felonies in their background and they're not eligible. So when we think about all the affordable housing issues that we hear discussed these days, we feel like people who are kind of left out a little bit are people at the very bottom who start with nothing. We couldn't find any better answers for them, so we decided to start our own pilot. We spend about $2 million a year on housing. We've got about 80 slots available for people, very nice apartments. The lease is in our name. because we know that when a landlord does a background check and a credit check of our people, they don't want them anymore. And we want ability to decide who is in and then who is out if they're not following the rules. So they get, we had thought of sliding scale rent, but that presented some problems because some of the residents work for Goodwill because we hire our own clients. So that was a kind of a conflict. So everybody gets free rent for 6 months or a little longer if we need to flex. They have to be working. They have to save a certain amount of money. They have savings goals. They have to take budgeting classes, and they do get drug tested. And they work with a Goodwill career coach. And when they graduate and go to their own housing, we give them $1,000 to go with the money that they have saved. So it's very nice to hear some of the people who are in our housing say, well, I heard one person say, well, I've got $3,600. And these are people who had nothing. And to hear another person say, well, I have more than that. So, and like I said, 62% go into unsubsidized housing. We are not eligible for much of the public funding, really any of it that we've identified, because we do have requirements of people. We're not a housing agency. We're not there to just get people off the streets. We're trying to use housing as a piece of the puzzle to help people move on in their lives. So because we have housing, that's different than the Housing First philosophy that controls most of the HUD money. And so we're trying to work with developers, banks to see people who can use some of the low housing tax credits and see if we can evolve a funding model that allows us to spread our dollars around more and throughout the state instead of just in Louisville.
Thank you very much for that. I know housing is one of those key pieces, I think, when you look at access to opportunity and moving people to stable environments and long-term success, it's critical. Huge. And so I'm very interested in that piece. I think appreciate you sharing it. I'll be following up maybe with you about that some more, because I think we're looking for models that are outside what we've traditionally been doing. And I think with the housing crisis we have now, it's going to take some things outside maybe what we've been doing to address some of those pieces of the puzzle, as you say. So I really appreciate that information. Appreciate your time here today.
Sure, we'd be happy to offer you a tour of our housing.
I would love that.
Yeah,
I would love that. We may take a field trip, Gerald. I'll do it. I think this would be exciting, and I think as we look towards policies in this space are really important. So I think that's a good idea. Yeah. Thank you very much.
Thank you very much. Again, we appreciate the opportunity to come and present.
Thank you. If there's no other comments from the commission members, I just want to reiterate, it is a new beginning. And so I'm excited to take the journey with you, if you will, along with Chair Timoney, and start some good conversations that hope to move us to some good policy recommendations and legislation moving forward. So I look forward to those conversations. And until next time, I thank you very much.
Thank you.
I'm sorry, the next meeting will be Monday, July 29th in here.